Okay, I wanted to stress a few things about spinal shock or neurogenic shock so that you'd be prepared for that. What happens initially at the time of the injury is that the spinal cord kind of gets like, whoa, thrown into a tizzy because of the damage done to it. So it might be that maybe T6 is where they have a fracture or partial fracture, whatever, an injury anyway. And because of the immediate swelling and edema that occupies that area around T6, it could be that T5 or even T4 could be kind of traumatized and have edema there. So it could appear that the fracture or the damage is higher than it actually is. So, that wouldn't maybe be quite so worrisome in the thoracic area, but if it was higher, say in the cervical areas, so if the injury was higher in the spinal cord, say in the C4 area, which remember that's where it controls the breathing, the diaphragm and everything. So it could be C6 and have some edema up into C5 and 4, and that we might have to be breathing for this patient, but we might not have to forever, because once that swelling goes down. Now the thing about spinal shock is that it usually lasts for about 48 hours. So until that time, the physician can't say, oh, absolutely, Billy Bob's never going to walk, or yes, he will, or what have you. So at least 48 hours, and even sometimes it can last for 7 to 10 days. And even after that, there are known cases where it lasted for a couple of weeks. I guess that's if there was lots of damage and tissue irritation and just damage done, and how fast or slow healing process and reabsorption and all is. A lot of factors would be thrown into that. So when patients ask us, well, when they've done x-rays, when's Billy Bob going to walk? Well, we don't know. And those are the things we really don't know, because at least 48 hours before edema goes down and we're able to look back at the patient and see what is going to be restored or not. So 48 hours, even up to a week to 10 days, far out a couple of weeks. But the majority by 48 hours or up to a week to 10 days. So those are going to be some of our standard answers for families and significant others. So what happens in this is that below the injury, they are flaccid, and they also may have wild spasms, so that we may have to give them a lot of muscle relaxants to help with that. And their heart rate, their blood pressure may be somewhat out of whack, but their heart rate may be lower. So this is a really kind of touchy kind of time, initial injury time for the patient, so that of course the respiratory system is going to be our priority, and then the rest will kind of fall into place with them. But I did want to mention spinal shock, and so that you'd be well prepared for that. Okay? Thanks. Might look up in the book, and I can't remember what page it is, but it's just a real short little blurb about it. Thanks.